So our next speaker is Dr. Eva Feldman, who is the James W. Albers Distinguished University Professor and the Russell de Jong Professor of Neurology and also Professor of Neurosurgery at the University of Michigan. She's a director of the ALS Center of Excellence there as well. She has a long-standing history of many productive investigations in ALS. She is, in particular, in recent years, been really predominant in studies of environmental factors that can influence risk for ALS, with multiple grants and papers attesting to this. We're very, very grateful that you're with us today, Eva. Welcome, and take it away.
Thank you. Can you see my slides? Can you see my title slide?
Yes, we can. Thank you.
Okay, great. Well, listen, Bob, thank you so much for inviting me. I'm very, very honored. And today, as Bob mentioned, I'm really going to talk about the ALS exposome. And I like to entitle it Where Science Meets Patient Care. And my disclosures in terms of funding are listed on the slide. So as many of you know, I really focused the initial part of my career in ALS research on trying to develop new therapies. And I was particularly focused on insulin-like growth factor 1, IGF-1, shown here in a little bottle. And over 30 publications, we brought it from really the bench to the bedside. We did a phase 3 multi-center clinical trial, which some of you may have been involved in. And I remember the day that we got the final results where the placebo line was like this and the IGF line was completely superimposed. So I took a breath, went forward and began to look at stem cell therapies and did 2 FDA approved trials, a phase 1 and a phase 2, looking at intraspinal stem cell transplantation. And the results there were we showed safety, and we never really were able to take it to a phase 3 trial to show efficacy. We were about to launch such a trial when COVID, right when COVID came. We were actually in front of the FDA the first week, the Monday, and COVID was announced on Wednesday. The country was closed down on Wednesday. And it never really went forward from that. And it really, I think that my focus on developing therapies and not being successful at it led me to say, should I focus in this last part of my career to better understand ALS risk and prevention? And that's really what had led me to exposome science. So it's really has been the natural evolution of my career. And I've been very fortunate.
May I interrupt you for just 1 second?
Yes, please.
Can you put your PowerPoints into a slideshow format? We're seeing the next. Yeah.
Oh, that's why I was asking if you were, is that better?
Perfect. Thank you.
Okay, sorry. That was what I was asking initially. Thank you, Bob, for correcting me. I appreciate it. So anyway, that's when, a decade ago now, really on the nose, I was fortunate enough to recruit and have joined me Dr. Stephen Goutman, a really remarkable young clinician researcher. And together we have gone on this journey of trying to understand the role of the exposome in ALS. And by definition, the exposome is the cumulative effect of environmental exposures and the corresponding biological responses we have to these exposures across our lifespan. And what the exposome leads us to is the gene time environment hypothesis. And quite simply, and then can you see my pointer here, Bob?
I am not seeing it. Can you wiggle it rapidly or use?
Yeah, okay. So let me see if I can't get some better pointer options. How about this?
Yes.
Yes? Okay, perfect. That's wonderful. So for the gene time environment hypothesis, what one believes or hypothesizes is that you're born with a baseline set of genetics. And what we will tell you is that we think that there is a polygenic risk in this disease, but over time you're then exposed to multiple different exposures, air pollution, persistent organic pollutants, pesticides, metals that make you more likely to be able to develop a disease. And in this case, of course, we're very interested in the gene time environment hypothesis for ALS. Now, we're particularly interested in Michigan, and I will tell you why. Our wonderful state, which I love living in, is both an agricultural state, but we're also a very industrial state. And early on in my career, it became clear to me that I was seeing, and I'm very bold to say this, I was seeing what I felt were clusters of ALS. One of the reasons I also became interested in the exposome. And I show you this map of the state of Michigan, where here in red are unclean Superfund sites. And then in blue are our toxic release inventory facilities. And if you want to look at then the presence of motor neuron disease in these areas, what's very interesting is, for example, in an area here in the upper peninsula of Michigan, where there's both a Superfund site and multiple toxic release inventory facilities. It's very lowly populated, yet we have multiple large clusters of patients from that area. We also have clusters from patients in this area, where really the incidence would be greater than one would anticipate if one was just looking at a straight incidence without taking into account the population. And indeed, ALS prevalence is highest in the Midwest. Now, this is some older data from Paul Mehta at the CDC, but the percentage holds in that the Midwest has the highest prevalence of ALS of any proportion in our country. And in more recent a recapture analysis that Dr. Mehta has done from the CDC, you can see now that the overall prevalence of ALS in the United States is 9.9 overall, with 13.3 in men and 7.6 per 100,000 in women. So it's really an increased prevalence than what was initially believed a decade ago. And when you look at this capture-recapture estimate that he has done, another interesting point is that while we say that the average age of onset, now this is prevalence, though not incidence. We say the average age of onset is approximately 60. Now, when you look at the prevalence, you see that the largest number of our ALS patients in terms of prevalence lie within the ages of 70 to 79. So now let's turn with that baseline of why I'm interested and how I got to the ALS exposome in Michigan to what I'm going to discuss initially. And that is, let me give you a little menu of the pollutants that we deal with. Pesticides and organic pollutants. We look at occupations and individuals' occupational exposures. We look at our patients' lifestyle and hobbies. We've also done work in the microbiome and the metabolome. So to begin with, when I talk about environmental persistent organic pollutants, these really derive from multiple everyday products. We have the organochlorine pesticides, and while these have been banned since the 1980s, they persist in the environment for hundreds of years. So they are in our soil, they are in our water. Polybrominated diphenol ethers, the PBDEs, these are also flame retardants that persist in the environment for years, are still used in many countries where we actually get our products from. Think about your carpet, your couch, and even some of the clothes that your infants may wear. The polychlorinated biphenyls, or the PCBs, primarily come from coolants and lubricants banned in 1979, but persist in the environment for decades. The environment, if you look at soil samples, if you look at water samples, you see an abundance of PCBs. So what we did initially was look at how plasma, first we did a survey, but then how plasma persistent organic pollutants correlate with ALS risk in patients. So in 2014, we did a very simple study where we, via survey, looked at individuals' pesticide exposure and found an increase in ALS risk. And that, again, was something that led us to then more quantitatively measure, which we then did in 2016, individual plasma persistent organic pollutants, the PCBs, the PBDEs, and the pesticides. We saw a very significant increase in ALS risk, particularly in the pesticides, where there was a 5-fold increase in ALS risk dependent on your pesticide exposure that we were measuring in plasma. We then most recently in 2023 published a new cohort of individuals where we looked at individual persistent organic pollutants, but we also then looked at mixtures, because you're not just exposed to one PCB, but you're exposed to a family. You're exposed to a family of pesticides. And when we then look at the mixtures, we were able to develop what's known as an environmental risk score. And this environmental risk score is really held. We just got a whole new set of analyses where, again, when we calculate what we call the ERS, we see a clear correlation between the ERS and increased ALS risk. It's anywhere between 3 and 5-fold, depending on how high your environmental risk score is, i.e., how much you have been exposed over your lifetime to these pollutants. Now, what's also interesting is that your plasma persistent organic pollutants correlate with ALS survival. So in a cohort of 167, these are cases only, individuals with ALS. When we look at both individual pollutants as well as an environmental risk score, we see a clear decrease in survival. And I'll actually show you some of the actual data from that. And most recently, we again looked at our new cohort from 2023, validating that same finding, that there's a clear decrease in survival if you have a higher environmental risk score based on your plasma pollutants. And here's an example of these data. So if we take all of our cases and we look at their environmental risk score and we divide them into quartiles, with quartile 1 having the lowest environmental risk score and quartile 4 having the highest environmental risk score, and we look at their survival, you can see that the lowest survival occurs in those individuals who have the highest ERS score. And in fact, it's a difference of about 0.6, and in our most recent cohort, it appears to be 0.8 years. Now, turning from our plasma measurements to actually looking at what do you do for a living, your occupation, and occupational exposures, and also lifestyle and hobbies. Our patients, and we also, of course, have a robust number of controls, complete a very, very detailed survey looking at their occupation, their exposures, and their hobbies. By detailed, it's a 30-page survey. And we look at their jobs over time, and not just their current job, but their jobs over time and their hobbies. And when you look at jobs, you can take jobs and you can place them in what are known as SOC or SOC classifications. These are standard occupational classifications. So, and then we perform statistical analysis of the SOCs as well as the hobby exposures. And in our first study, which we published in 2022, we looked at 381 ALS and compared these individuals to 272 healthy controls. And what we found was that in individuals who were in production occupations, those are individuals on the line, individuals with jobs with pesticide, metal, or particulate matter exposure, there was a clear increase in ALS risk. In a second study, which were cases alone, we looked at ALS survival and found a decreased survival in individuals with production occupations, those who have served in the military, and those with jobs with pesticide exposure. And also, interestingly, in those individuals who are on the line in production occupations, we see an increased incidence or prevalence, I should say, of cervical onset ALS particularly. So I wanted to let you know that this type of work has caused a lot of interest, and we're very glad about that. I'm sure you can't read this first sentence, but I'll read it. If you're a welder, work on a production line or have a job that involves exposure to metal solvents. Whoops. Oh, something happened to my screen. Whoops.
Yeah. Someone has tried to share. and
Okay.
Should not have. Can you try again, Eva? Our apologies.
Oh, am I,
Apologies,
okay.
Eva.
Am I knocked off?
Yes, can you try to share again, please? I think you were
Of course I
interrupted.
will.
Thank you.
Am I back on?
You are
Yes.
now, and it's quite
And
clear.
am I in the right mode?
Yes, you are.
Yes.
Okay, so I was just gonna say, I just finished saying, or exposed to pesticides, you could be at a higher risk for developing ALS. And I'm pleased to tell you that because of this public interest, it appears that Michigan will soon be added to the list of states where ALS will be a mandatory reportable disease. Let's see, so now, for reasons that are unclear, it's not advancing. Okay, and another reason we are so interested in production occupations is that production occupation in the Midwest is among the highest in the US. And here you can see in Michigan, 10.2, 1 out of every 10 workers is in a production occupation. And here we have Indiana and Ohio. So that's probably why also the Midwest may have the highest prevalence, or does have the highest prevalence of ALS. Now, turning to lifestyle and hobbies, which correlate with ALS risk, exposures, the exposure or the hobby, golfing, hunting, shooting, woodworking, increase ALS risk. Gardening appears to be associated with ALS risk. Swimming and lifting also increase ALS risk, particularly if the swimmer or weightlifter is of a younger age. And this, of course, are data that we have published. So to end in a bit of our menu of the ALS exposome before I turn to our genetics is the microbiome and the metabolome. For this study, what we did is we looked at the baseline microbiome in 75 ALS cases and 110 controls. We actually have the microbiome at later time points in these individuals, but we primarily looked initially at the initial time point and compared it to the baseline metabolome in those individuals. And we found the following. So I'm just summarizing a lot of work in one slide. And that patients with ALS have a clear decrease in their microbiome diversity. And with that, they have a clear decrease in the beneficial immune modulating butyrate producing microbiota. So there's a clear correlation between the microbiome and the immune system that holds very tightly in 2 separate studies in our hands for ALS. So I mentioned the gene time environment hypothesis initially. I've clearly told you about the exposome in terms of the pollutants. Now, why don't I turn to the genetic portion of the talk? Let me begin by telling you briefly about the polygenic risk score that we've developed, and then turn to our work in the epigenome. So we have found that a polygenic risk score correlates with ALS risk in patients. It's not that robust, but it definitely correlates. And of course, most of the studies focus on a single gene, C9, of course, being most common. But what we did, as one does in a polygenic risk score, is we examined incremental contribution from many small changes in genes, the SNPs, the single nucleotide polymorphisms, which is why it is a polygenic score. And what we did is we found an increased ALS risk when we developed a polygenic score using 275 single SNPs. And here's looking at how our polygenic score improves ALS risk classification. And we have published this, and we did all of this work in collaboration with Brian Traynor at the NIA. But as you can see here, the polygenic risk score here in purple modestly increases baseline risk classification for ALS. So it is not overly robust, but it appears to hold because we now have again shown this in a second cohort of individuals. And we also showed this in a European Spanish cohort. Turning now to the epigenome, I'd like to tell you just 3 brief stories about how we have seen altered DNA methylation in our patients, altered microRNAs, and now, very excitingly, I think it came out this week, have shown a change in the epigenetic age or the clock of our patients. So epigenetics, simply by definition, is just altered gene expression without changes in your baseline, in individuals, without changes in the very baseline genetics. So as you know, unmethylated CpG sites allow DNA to be transcriptionally active. And however, when these sites are methylated, and most commonly it happens to cytosine bases, these methylated CpG sites cause the DNA to be transcriptionally inactive. And what we found, and then turning to the microRNAs. So if there are no microRNAs, mRNA is translated. The microRNAs also can negatively regulate target mRNAs. And so with microRNAs, mRNA is frequently degraded and there are no beneficial proteins that are produced. So now turning to the epigenetic changes in ALS in terms of DNA methylation and our microRNA work. Early on now, over 10 years ago, we did a very small study looking at epigenetic networks in spinal cord autopsy patients, in spinal cord autopsies from 12 ALS patients versus 11 healthy controls. And what we found was increased DNA methylation in pathways involved, particularly in the immune system, extracellular matrix, and neural development. We then did a subsequent larger study looking at just microRNA levels and epigenetic networks in spinal cord and found very similar results in terms of changes in immune, cell death, and neurodegeneration pathways. And then most recently, what we did was a larger study looking at microRNA levels and epigenetic networks in both fibroblasts and blood from our patients, 65 patients or 65 cases versus 27 healthy controls. And this time again, we see changes in immune pathways, plus metabolism, ALS, neurodegeneration, and synaptic pathways. So interesting epigenetic changes that we observed. We have become much more interested, or very interested, in better honing in on DNA methylation patterns. And as you know, DNA methylation patterns can define what are known as epigenetic age. So we all have DNA methylation as we age over time, and there is normal aging or normal epigenetic patterns due to DNA methylation, and that is our chronological age. So however old you are, you know that your ideal chronological age would have an ideal epigenetic pattern. So the DNA methylation patterns can define your epigenetic age. So you can have a younger biological epigenetic age and a longer lifespan than your chronological age. So you can have a better epigenome than your actual age. So you can have a young epigenetic pattern. And then, of course, in contrast, the negative, you can have an older biological epigenetic age, a shorter lifespan, and your chronological age. So a distinct old epigenetic pattern. So while you should have a younger epigenetic pattern, say at the age of 60, your epigenetic pattern looks like you're more age 70. So an older chronological age is called your grim age. And so what we have done is we've looked at the DNA methylation, epigenetic age, and acceleration in our patients. And what we find is that ALS cases generally have higher epigenetic age at the same chronological age as the controls. So our patients have clearly more changes. They have an older grim age in terms of their epigenetic pattern. And indeed here, I think it shows it better, at least visually, and that here we have the controls And here we have our ALS patients. So the controls, when compared to controls, our patients are 1.8 times or more likely to have an older grim age and have more epigenetic changes, as you will see to the negative. So a faster epigenetic age acceleration shortens ALS survival. So in this case, we looked at, then again, grim age and epigenetic age acceleration in our patients, and we were able to divide them into fast, average, and slow progressors in terms of survival. And what we see is those individuals with, that have a fast age epigenetic, have epigenetic age acceleration, have a faster progression of their disease than those individuals with the slower or more beneficial epigenetic pattern. And interestingly, this is very sex dependent. So if we look at those individuals who have a poor survival, they are primarily males with a larger, I would say, more grim age. So more methylation, a higher grim age, more epigenetic negative changes are the men. When compared to the women, look at the females versus the males. So all of our findings in terms of the epigenome, in terms of the grim age, were really being driven, or are being driven, by men. And finally, when we look at then our controls versus our ALS and look at the age acceleration, we find those individuals with the highest exposure to particulate matter, volatile organic compounds, pesticides, metals, and disease and diesel exhaust have the highest age acceleration and the highest grim age. So in summary, I think our ALS research strongly supports the gene time environment hypothesis. And we're now really getting into the more detailed aspects of looking at the epigenetics of exposures. I strongly believe the ALS community is now ready for us to go and implement risk prevention strategies, something that I think many of you know I'm very passionate about, that we really have enough data now that we can show that exposures increase risk, decrease survival, and are linked to epigenetic changes, so that we should be involved and advocating for prevention strategies. And in my last slide, I will tell you that we have begun a first-in-kind prospective study of ALS risk worldwide, where we are entering 4,000 healthy production workers here from the state of Michigan. They're completing electronic standardized surveys of exposure, lifestyle, general health, motor function, brain health. And we're also getting a cheek swab to look at a polygenic score. And we really hope that this prospective study will help us even better understand ALS risk and will allow us to engage in these prevention strategies like our colleagues in cardiology or our colleagues in oncology. So ALS prevention is real and obtainable, and that's where I say that the exposome can allow science to meet patient care. I'd like to thank all the individuals in my group who have really been outstanding to work with, particularly, of course, Dr. Goutman, but then all of our wonderful collaborators, because it really does take a village to do this type of exposome work. And I'll stop sharing there, and I thank you for your attention.
Thank you so much, Eva. I think that's a tour de force, and one that's long overdue, badly needed, and greatly appreciated. Thank you for that.
Well, thank you.
No, seriously, this is the kind of, I think all of us on this call and in the ALS world have the intuitive sense that you are completely right, and that this is, as thus far, an inadequately studied area for ALS research. We have time for just one question because we're a bit over time now. But one question asked by Indu Magan is, do you also look at epitranscriptomics, i.e. such as mRNA modifications like M6A? In addition to
I tell you, we're currently doing that in partnership, and actually it's primarily been done by Dr. Sami Barmada here at the University of Michigan. And I don't want to speak for him. Is he on this as he is participating, but he's finding some very interesting changes. So yes, that's being done by Dr. Barmata.
That's interesting. And just real quickly, there's some interesting questions from Lyle Ostro regarding sort of feedback. So just briefly, for example, ALS patients have decreased mobility, less time outdoors. That might influence their expososome. It might influence the way they encounter the environment. And
so my comment would be, what's interesting about the exposome measurements that we do is they really do, reflect your lifespan, okay? Because what we're looking at are compounds that you've been exposed to throughout your lifespan, not just, not just recently. I think that's important to note. And also the surveys that we do go back, since with your first job, and some of these individuals many are in their 60s and 70s. So I do agree there's some of the compounds that one measures have a very short lifespan, but we are looking at compounds that are enduring in the environment and endure in our bodies also.
Thank you. That's much appreciated.